All right, so in this particular discussion today, we'll look at the bony pelvis. These are the walls that make up the pelvis, focusing only on the bones. The soft tissue, for example, muscles and ligaments, as well as the content, will not cover that in this session. We'll cover that in a different session altogether. So in this discussion will serve as a preamble to the reproductive system. So what we have here is a bony pelvis. So the bony pelvis is made up of the following bones. So we have 4 bones in total. Number 1 is the left and right innominate bones, or what you can call the hip bones. That is hip bone right, hip bone left. The 2 hip bones meet anteriorly here at a joint known as symphysis pubis. Then we have 2 more bones posteriorly. That is the sacrum and the coccyx. So that's 4 bones in total. 1, 2, 3, and 4. Equally, we have 4 joints connecting these bones. So 4 joints, 4 bones. So joint number 1 is anterior, which is the symphysis pubis. This is a fibrocartilaginous joint, a very tough joint. Then we have left and right sacroiliac joints. That joint there between sacrum and the ilium. This is the ilium of the innominate bone. That is the ilium. Then that joint there is sacroiliac joint. Then there's the sacrococcygeal joint here. Sacrococcygeal joint. So that's it, 4 in total. Now, these bones, even though we are looking at them as single bones, like this is 1 bone, that is 1 bone, 1 bone, 1 bone. They are actually what we call or refer to as fused bones. So we'll start with the innominate bones or the hip bone and see which of those bones are fused to give us a single bone. So I have a diagram here. I'll try to expand it a bit. Okay. So just allow me to use the pointer now. Okay. So you can see the different colors. That is ilium. It's a hip bone. It's this bone that has been put here. We are looking at this bone from the lateral view. So this is anterior, that is posterior. You can know that this is anterior and this is posterior because of the following features. Anteriorly, the pubic bone is sharp there, so it projects forward. Then on the ischium, there's a sharp projection known as the ischial tuberosity, which points posterior and lateral. So that is a ischial tuberosity. Then there's the sciatic notch here. That is a sciatic notch. So there's a greater notch and a lesser notch, both referred to as sciatic notches. So these are found on the posterior aspect, then that is anterior aspect. So let's look at this bone now in some more greater details. So I'll beg your pardon. I want a bigger diagram so that you can easily follow through. Okay. Well, it seems this is a best diagram we have so far. Okay, so that's the ilium, that is a pubic bone, that is a ischium bone. All these bones meet in this cavity known as acetabulum. So this is the acetabulum. That's where the 3 parts are joining. So there are sutures there, like you can see, especially in younger individuals, you can see that there's still hyaline cartilage in between there where the bones are meeting. But in adults like you and I, you can't see the joint. The bone becomes 1, but actually it's made up of 3 parts. So start with the superior part, then look at the inferior parts. Superior part is the ilium coming Come in. How are you? All right, I'm in class. You wanted to see me? Concerning... Oh, then we just make some time. Okay. Just send me a message and I can tell you when I'm done. All right. Okay. All right, so I was saying this is a ilium. The superior part of this bone is a ilium. So when you are standing and you put your arms on your waist, this is where the arms are resting. So the superior part of the ilium is known as the iliac crest. So that is the iliac crest. Okay. Then on the anterior surface of the ilium and the posterior surface of the ilium, we have two projections. So anteriorly there are two, a superior one and an inferior one. Posteriorly there are two, superiorly and inferior ones. Now, the anterior ones are given the name anterior, posterior ones are given the name posterior. So the anterior projection, we call them the anterior iliac spines. So since one is superior and one is inferior, so the one above is what we call the anterior superior iliac spine. Anterior superior iliac spine. That is ASIS or ASIS. Then the one inferior will now be called the anterior inferior iliac spine. So this one is easily palpated. You know, when you run your fingers in front of your pelvis there, you feel these sharp bones. This one is a bit blunt, so they are very difficult to palpate. Equally, on the back, we have two. That is on the dorsal surface. So this one will be the posterior superior iliac spine. This one will be the posterior inferior iliac spine. These are the bones we're talking about. Anterior superior iliac spine, anterior superior iliac spine, anterior inferior iliac spine. Now, within the ilium, there are two surfaces. This is the ilium. There's a surface inside and the surface outside. So the in surface, we call it the iliac fossa. So that's the iliac fossa. At the same time, this is a wing or the ala of the ilium. So the wing or the ala of the ilium has two surfaces. The inner surface is the iliac fossa. The outer surface is the gluteal region. Gluteal region. Now, you see that the iliac fossa is smooth, very smooth, but the gluteal region has three lines. We have this line that is superior, we have a line that is middle, and the line that is anterior. Oh, sorry, this is posterior, that will be middle, this will be anterior. So we call these as gluteal lines. Posterior gluteal line, middle gluteal line, and anterior gluteal line, or superior gluteal line, middle gluteal line, and inferior gluteal line. Again, if we observe on the iliac crest, there's this widened and thickened part. We call this as the iliac tuberosity. Iliac tubercle, sorry. The iliac tubercle. That is the iliac tubercle there, which can be seen there. That's the iliac tubercles. Okay. And then we finish off now with the ilium. So we're saying on the posterior surface of the ilium, there is this notch. And this notch is known as a greater sciatic notch. It's a the sciatic nerve that creates that impression there or depression. This is where the sciatic nerve emerges from inside the pelvis to go to the gluteal region now. And the sciatic nerve, like we say, is the largest peripheral nerve in the human body. The other part to look at is a pubic bone. So the pubic bone is inferior and anterior. This is a red bone that is shown here. Now, There are features that are found on the pubic bone that are of importance. Number one are the pubic tubercles. These are the iliac tubercle, like that one. Now, pubic tubercle are these small lumps there. Those are the pubic tubercles, left and right. Then the superior surface here, which is there, of the pubic bone is what we call the pubic crest. So all this surface here, that is a pubic crest. In addition, the pubic bone has two rami, superior rami and inferior rami. So it makes like a C-shaped structure like that, like this. So this is inferior rami, superior ramus. So the superior ramus of the pubic bone is continuous with the superior ramus of the ischium. This is the ischium or the ischial bone. The inferior ramus of the pubic bone is continuous with the inferior ramus of the ischium. So that is the ischium and its rami. And between the four rami, two for the pubic bone, two for the ischial bone or the ischium, there is a foramen there, like we can see. That foramen is known as the obturator foramen. It's covered by some membrane, and there's a nerve that passes through here from the pelvis to go to the leg or to the thigh. We call that as obturator nerve. So obturator nerve passes through here to go to the thigh and control muscles in the medial compartment of the thigh. So that is about the ischium and the pubic bone. Now, the ilium and the pubic bone. I'm in class. Now, the ischium bone, like we were saying, has two rami, superior rami and inferior rami. In addition to that, there are two features that we must be aware of. The posterior aspect of the posterior and inferior aspect of the ischium bone is thickened. So we call that as the ischial tuberosity. Not tubercle this time, but tuberosity. And this bone is the bone on which we sit. Okay, so that is the ischial tuberosity. Then if you follow on the posterior aspect, you see a sharp projection from the ischium. That projection is known as the ischial spine. So the ischial spine projects posteriorly and medially. So it's a very sharp bone. And this ischial tuberosity is sharper in males than females. So just by observing this bone, whether it is blunt or sharp, you can actually determine whether you're looking at a female pelvis or a male pelvis. Okay, so the pelvic bones are one of the bones in the human body that are used for forensic examination. In an event that people are bent beyond recognition, you can identify the gender of an individual by examining the bones of the pelvis, plus other bones of the human body, the skull included, and the long bones. So bones say a lot about the gender of an individual. That being said, now we can look at the pelvis itself. So pelvis is divided into two parts. We have a true pelvis and a false pelvis. So false pelvis is superior to this area here known as the brim. This ring here is known as the brim of the pelvis. It is also known as the inlet of the pelvis. It is also known as the arcuate line, or you can simply say the linea terminalis. So that circular ring there has a lot of names. The brim of the pelvis, the inlet to the true pelvis, at the same time is known as a linea terminalis. So that area separates true pelvis from false pelvis. It's about this plane here. So if you cut there, above all this area going up there, where the pubic tubercle is, going up is a false pelvis. We're looking at this space going up, false pelvis. So the false pelvis is very wide. Then at the level of the pubic crest going down, which is this label from the brim going in, is what we call the true pelvis. So the true pelvis has bony boundaries, anterior, lateral, and posterior. It is surrounded by bones. But the false pelvis, the anterior part has no bone here. It's open. So it has no anterior border. So that's why it's called the false pelvis. So the false pelvis is also known as a greater pelvis. The true pelvis is also known as a lesser pelvis. There are diagrams here that we can use for that explanation. So here, that is the inlet or the brim. And this green part, dark green part, is a true pelvis. This is where the baby will pass through during labor to be born. So that's why we call it true pelvis. Then above is a false pelvis. Okay. Now, the true pelvis is divided further into 3 regions. It has an inlet, which is the first part. It has a cavity, which is all this region inside there. It has an outlet, which is the exit there. So when the fetus is about to be born, it will first of all enter the inlet of the true pelvis, be in the cavity of the pelvis, then finally leave the pelvis through the outlet. And at that stage, the child is born. So the child negotiates through bony structures. And since bones do not expand, measurements of this pelvis have been done and therefore are required to be in standard measurements if at all a woman can deliver via normal spontaneous vaginal delivery. So, hello? Okay. Yes, how are you? I'm all right. Oh, sorry, I'm in class. But we can still talk. Mm. Yeah, sorry for that disturbance. Just give me a moment. Right, so I was saying for the baby to be born, they have to pass through the true pelvis. Now, let's look at those measurements, just some of the few that are very important when it comes to obstetrics and gynecology. Okay. All right, so we have the following, measurements. So we have what we call the anterior posterior diameter, of which there's a diagonal conjugate or the true conjugate. The true conjugate measures direct from the sacropromontory. Now, this is, before I explain those diameters, this is a sacrum. Now, we're saying the sacrum, the first sacral bone, these are vertebral bones. A vertebral bone has a body, so that is the body, the central part. Then vertebral bones have transverse processes. These are processes that face lateral. So that is a transverse process. Then vertebral bone have spinous processes. These are projections that face posteriorly, like we can see from the back there. Now, the sacral bones are fused to give us a single sacral bone. But the first part there, the first body of the first sacral bone projects into the cavity. So it reduces the diameter of the pelvic inlet. This is a pelvic inlet. So because of that projection, what you call the sacropromontory, The inlet to the pelvis is said to be heart-shaped, shaped like a heart because of this projection of the sacrum into the brim of the pelvis, and therefore reduces the diameter from the promontory all the way to the inner surface of the pubic symphysis. This measurement is about 12 centimeters. Okay, so that is 12 centimeters from here to there. Then we have the transverse diameter now. Transverse diameter is measuring from left to right. The diagonal or the true conjugate measures anterior and posterior, but the transverse diameter measures left to right. So you find that the transverse diameter measures about 13 centimeters. So this transverse diameter is wider than the conjugate diameter. And therefore, during labor, when the baby comes and wants to pass through the birth canal, the head of the baby turns so much that the presenting part, which is mainly the head, the occiput should be here and the forehead there, facing the direction of the transverse diameter, because that is the widest diameter on the inlet. Then in the cavity, all diameters measure the same. Okay, they are all measuring about 13 centimeters. That is in the cavity. Then when you go to the outlet, okay, you find that again, it is now the anterior posterior diameter that becomes wider. So again, when the baby is leaving the pelvis, it has to turn its head so that it faces in the direction of the conjugate diameter. So the occiput will be here at the arc of the pubis, and then the forehead will be facing down there. And that way the baby can easily come out of the pelvis during labor. So those are the three most important measurements. In addition, we can also throw in the oblique diameter, which is about 12.5 centimeters, but still it is a transverse diameter on the inlet that is widest. And therefore the head of the baby should turn in respect to the widest diameter. So that's it about the innominate bone, which is a hip bone. Now let's look at the sacral bone. So the sacral bone forms the posterior border of the pelvis. We're looking at this bone here, ending there at the coccyx. So there are 5 fused bones. 1, 2, 3, 4, 5. Now, since they are fused bones, we consider it as a single bone. Okay. So that is the sacrum now being viewed from anterior surface. That is the anterior surface. Then we said the body of the first sacral bone anteriorly forms the sacral promontory, which reduces the anterior posterior diameter of the pelvic inlet. Now, we observe that the sacral bone itself also has wings, or ala, if you like. So that is a wing, that is a wing. Similar to the innominate bone or the hip bone. So there will be a joint here where the sacrum meets with the ilium, which we call the sacroiliac joint. So the sacroiliac joint is a slightly mobile joint. So there's some bit of movement. But when we age, 60 towards 70, that mobility is restricted. And therefore, if you observe the elderly, the way they move, the pelvis is stiff, okay? Because that joint, sacroiliac joint, begins to fuse, becomes to harden, okay? Different in younger persons like you and I, where there's where there's mobility. That mobility is even made more prominent in a woman who was about to deliver. When the pregnancy has run its course towards 9 months of gestation, you find that ligaments in these joints tend to loosen up so that the pelvic can be flexible and allow the baby to be born during labor. So that is a sacral bone. Posteriorly, this is a sacral bone that we can see. Now, sacral bone is fused bones. So you see that all the transverse processes as well as the spinous process of the sacral bone are fused up like that. Then towards the inferior end of the sacrum, that is posteriorly, there's a gap that is left there. We call that as the sacral hiatus. Now, sacral hiatus serves as a point of exit for the terminal end of the spinal cord. The spinal cord is always running and being protected by bones in the vertebral canal. Now, at the tip of the sacral bone, there's a wide area which is open there, known as sacral hiatus, and serves as exit for the terminal branches of the spinal cord, what we call the cauda equini. The cauda equini. Okay. Then we have the conures of the sacrum. So these will form joints with the coccyx. Conure of the sacrum and conure of the coccyx form a joint, so that now the sacral hiatus is converted into the sacral foramen, so that the structures I explained, which is the terminal end of the spinal cord, can now leave the the vertebral canal. Coccyx. So we're looking at 4 fused bones. So this is the tip of the vertebral column. It's considered a single bone, but actually there are 4 bones that are fused up to form a single bone. So the joint between the coccyx and the sacrum is what we call a sacrococcygeal joint. There. That is a sacrococcygeal joint. Now, this joint also is mobile. So during labor and during defecation, this joint is mobile. Okay? Oh, okay. Nanja, mlesa video will forward. It's only you I told to come and see. What about you?
I don't do what I'm doing.
Go back, because you won't be just coming here like that. She'll find you.
I go home.
Even home is fine.
Sir.
And listen, go and close the door, because I'm in class right now. Close the door. Close the door, because what I'm discussing doesn't concern you. You come here if you have an issue that is serious. That's it. Check in this plastic first. All right, sorry for that. I was attending to my students. So here we are saying there's a joint, which is a sacrococcygeal joint, which is a mobile joint. This joint is mobile and essential during process of defecation as well as child labor. There's a diagram I had earlier on that I want us to refer to. Okay. What is that diagram? Yeah. So this is a coccyx. In natural position, this is where the coccyx is. But during labor and defecation, the coccyx can move posteriorly. That is at the sacrococcygeal joint there. So that is a mobile joint as well. But between the sacrum and the lumbar bone, which is there, mobility is not possible because these are intervertebral discs and these are fibrocartilaginous joints that are very firm and don't allow or permit movements. Okay. Are you sure that's the one? All right. Okay. So what I would like you to do now is just to compare between male and female pelvis. So this will be your assignment. Make sure that you look at those differences and similarities. Okay. Otherwise, that's where I can end for now with the pelvis.